My mother, 50 years ago, they told her she was diabetic. Here, prescription. She walked out the door. My mother never learned how to take care of herself. My mother didn't know what to eat. And because of that lack of education, she lived through the complications of diabetes. To educate patients and to work one-on-one with the patient, that is beyond rewarding. My name is Iris Leon, and I'm a registered nurse at Union Health Center.
The Union Health Center started in 1914 to take care of the garment workers who were faced with an epidemic of tuberculosis. Today, patients are union members of many different unions. Laundry workers, porters, housekeeping services, doormen. But the mission of the Union Health Center has always been the same, to take care of low-wage immigrant working people. Prior to 2005, providers were always responsible for educating patients and taking care of the patients, and it was just too time-consuming for them. We had to change somehow. The traditional model of healthcare is just something that providers can't do alone. A patient medical home, it's not only a place where patients come when they're just sick, but it's a place where they can learn and get educated on how to take care of themselves.
I've been an RN for 36 years, and I've had vast experience in nursing, administration, as well as education. What I've learned being here, it's a different approach to healthcare. These patients have to be involved and educated in taking care of themselves, and the staff needs to be able to provide that education. So in order for them to do that, they have to be trained on an ongoing basis. That is so important.
During this time, the providers, the medical assistants, the RN, the supportive staff, we meet and we discuss issues and problems that have come up, and we troubleshoot. And then the following week, there's team training where they go through a curriculum.
We actually ask the providers, really, what do you want your patients leaving the health center to take with them? And how do you want them to learn it? I know a lot of people would say we just have to keep working. We have to see patients, like 7-8 hours a day. But the protected time really pays off at the end, because that's the only way you're going to be able to have your medical assistants become skilled in things that they didn't learn prior to coming into this position.
To be honest with you, I was resistant to the idea of taking the traditional role of the medical assistant and making it a little bit more than I thought it should be. Well, after all the training, I was able to honestly feel that it could be done. I don't think that I would have gotten to be an RN if it wasn't because I got that training.
I believe that the protective time here has made such a huge difference in building the medical home teams. It allowed us a lot of time to learn, and also now I feel there's better communication between the team, between the medical assistant, the provider, the health coaches, the patient support staff. They're able to communicate much better.
Support is a very important piece of working in healthcare, and knowing that you have a team, so it's not just one individual, but multiple people who are all geared toward the same goal, makes a big difference in keeping your own motivation up. And I think that what I've found the most amazing is that not only are there people dedicated to doing this, but they are showing that they can have good outcomes.
If someone told you you need to do this, this, and this, you're not going to do it because it's not what you want to do. You have to allow the patients, just like you have to allow the staff, to take charge. That's what this is all about.